Okay, now we are recording. Thanks for the notification, Annette. So we are planning to spend max 1 hour, but I understand that all of you are really busy and it's end of the year, so we are approaching different deadlines. So we try to minimize the use time today, but let's tackle this seminar. Okay, so basically, Ms. Annette is going to start by telling a little bit about MEGA and how we have reached this point. Afterwards, I'm telling how to use the MEGA application, like technical point of view, and then we are also tackling the future approaches for the MEGA application and the MEGA project. So afterwards, we are going to have discussions if there are any questions. I see that the most of the participants are coming from the MEGA consortium, so you might not have that many questions or comments, but if you have any, you have possibility to make these comments and questions afterwards. And we are also recording this conference so that we can use it as a dissemination material for the future. Also, a separate report will be written after this conference and uploaded to the Messi. So if needed, you can share it with the partners and read it if you want. Okay, so Ms. Annette, would you be ready to start with the first presentation?
Yes, I would. Thank you, Timo. I'll just share my screen. Let me know whether you can see it.
Yeah, we can see it.
Okay, perfect. Welcome everybody. My name is Annette Bejnarovića. I represent the International Project Unit of Riga Technical University, and I will give a general overview of the MEGA project, how it came about, what we have been doing for 3+ years already. So it might not be that interesting for the consortium members. I can see some familiar names in the participant list. But as Timo already mentioned, it will be recorded so we can share it also with other interested parties, and hopefully it will give them an insight of the MEGA project. So first things first, a little bit about the background of the project. So why did we even think of this idea and thought that it's relevant? Some of the reasons might seem obvious, but still I will mention them. So keeping young people healthy, of course, has a positive impact on productivity and competitiveness. Thus, new innovations are needed to find solutions to promote mental health and prevent mental health problems. Also, research suggests that half of the mental health problems start before the age of 14. That's why we decided to focus on adolescents within the MEGA project. And also one very important aspect that we mentioned in our project application was the environment and how the environment has both direct and indirect effects on mental health. So that was already more than 4 years ago when colleagues from Turku University of Applied Sciences in Finland met some colleagues from University of Pretoria and kind of started brainstorming on the first idea and started assembling the team for the MEGA project. Also, the relevance of the MEGA project is reflected in the United Nations Sustainable Development Goals, because promotion of mental health is one of the main targets of the Sustainable Development Goals for 2030, and it has raised focus on the prevention and treatment of non-communicable diseases, including the mental health of children and adolescents, which constitute a major challenge for sustainable development. So even though the MEGA project focus might seem very focused kind of and precise and maybe narrow, it actually has much wider implications and long-term goals in relation to the Sustainable Development Goals. And if we speak about the specific project goals, when we started the MEGA initiative, the main aims that we listed were to map the Southern African Development Community country landscape related to primary healthcare workers. Which is one of the main aims of the project and also of today's seminar, the mobile application that we developed for primary healthcare workers to help them screen mental health problems. Also, within the project, we developed e-learning materials. Another goal was to train the trainers and educate primary healthcare workers so they can use the application. And of course, last but not least, disseminate the results to policymakers, higher education institutions, professionals, and also the general public. And along these aims, the outcomes that we expected to reach were, as mentioned, to develop and implement a mobile application for mental health assessment. One of the main aims and outcomes that we expected is to create a tool that lightens the workload and facilitates the screening process, because really the last thing we would want to do within this project is to create something that is a burden for the primary healthcare workers and that disturbs their work, because we know how limited the time is they can spend with one patient and how high their workload is already. So our aim was to create something that really lightens this load and helps them daily. Then another outcome was to scale up mobile services for mental health disorders in children and adolescents in South Africa and Zambia. And one of the most important long-term goals, in my opinion, to raise awareness on mental health, and very, very important, to reduce stigma, which exists, unfortunately, and surrounds mental health related issues and mental health problems. In order to reach these goals and outcomes, we formed a consortium, which is led by the Turku University of Applied Sciences in Finland. From Europe, we have two more partners. Us, Riga Technical University from Latvia, and from Germany, Hamburg University of Applied Sciences. Then from Zambia, we have University of Zambia and Lusaka Apex Medical University. And from South Africa, University of Cape Town, University of Pretoria, University of the Free State, and Stellenbosch University. And just briefly, I wanted to show you the project timeline. So what we have been doing, highlighting the main issues we have tackled each year. So the project began in 2017. In October, we had a kickoff meeting in Pretoria. The first item on our agenda was to obtain ethical approvals, because any project that is related to people, their health data, and so on, has to have everything correct with the ethics. So that was something that also went on throughout the second year of the project, but we started it as soon as the project began. And also, as this project aims to help primary healthcare specialists, also one of the first things we did is we visited primary healthcare facilities to actually talk with the specialists who work there, to see the situation and to understand what we need to do better. In second year, 2018, we had a lot of lovely meetings. It was possible to travel. That seems like a different world, but yeah, we had a partner meeting in Bloemfontein. We had a partner meeting in Lusaka. One of the main items on agenda in 2018 was already starting the data collection. We also had a project meeting in Riga, so we hosted our partners here. And in Riga, we very actively discussed the contents of the questionnaire that is to be included in the mobile app. So it fits the needs of the project and of the specifics of the work. In 2019, we visited our coordinators in Turku, worked on the validation of the questionnaire. We also had training of trainers, a very lovely workshop in Cape Town. We began testing the functionality of the app and also piloting the app. And originally it was planned that the piloting will end in 2019 and the project will end in 2019, but due to COVID-19, the project is still ongoing because of course the piloting was disturbed and we're still continuing it. Also, we're rescheduling the final activities as we were planning to have a final conference in Lusaka. So we are at the moment trying to find the best solutions to finalize the project. So that's just briefly about our timeline. As this seminar is dedicated to the mobile application, and my colleague will tell you in more detail about how to use the app, how to download it, and so on, I just wanted to very briefly go over the main principles that were taken into account when deciding on the design of the app. So first of all, first and foremost, we wanted to make it as user-friendly as possible, so it can be used without extensive previous education or experience. So just with short training on how to use the app. As I have emphasized many times and will continue to emphasize, our aim was to create something that is user-friendly and can be helpful in the daily work of the primary healthcare specialist. Also, of course, we wanted the app to be easy to download and possible to use without any additional equipment. Then, yes, the tailor-made questionnaire that we worked on that was designed by mental health care and IT specialists from the MEGA consortium. One very important thing that we are still working on is to ensure the safe storage and management of data, because as I already mentioned, when it comes to dealing with health data of people, it's very, very important to make sure that everything is according to data protection rules and laws. And what we are also still doing is improving the app based on the feedback that we are receiving during the pilot phase. So that's just very briefly. And before I give word to my colleague Timo, I just wanted to kind of advertise our MEGA project website, because all the educational materials that were developed during the project, they are accessible. They are meant to provide an insight on the application, the technical setting, the clinical content, and the link I have pasted here goes to the MEGA website, and you can see these 4 circles and press on them, and underneath there's really a wide variety of materials developed by our mental health and IT specialists that is available and can be used, and we would be just happy if people consulted these materials and use the opportunity. So that's very briefly from my side. I will give word to Timo, and he will focus more specifically on the application. If there are any questions at this point, I will do my best to answer. Thank you so much.
Thank you so much. Can you stop sharing? Thank you.
Yes.
Okay, so next steps are, I'm going to hold a small presentation how to use the application, show the video what we have made, and previously generated the manual, how does it look. And afterwards we are going to have a again presentation by me about the future of the application and recommendations. So I will share my screen. So I hope that you can see my screen.
Yes, we can see.
Okay. So how to use the application? So so far we have generated these tools to make nurses and end users' life easier. So we have made manual so that because nurses might have problems to how to install the application and how to use it. So we have made a manual. So I will run through the manual quickly. And why I'm showing this, because this is a great learning curve to see how the application has also changed during this past years. Because as Annette mentioned, we have implemented changes which are required by the partners. So based on the feedback, we have implemented different changes. So currently this manual can be found from Messi, and if needed, you can always contact me or the local partners and ask them, like, can you please provide the manual? Because as we know, the resources in the clinics or the university might be limited. So that's why we have made a manual, which can be even printed if you want to have this way to learn how to use the application. We understand not all the users have access to online tools or videos, so that's why there is a manual which can be printed. So of course it starts how to install the application. How does the installing process looks like?
Timo, sorry to interrupt. You are showing the manual?
Yeah, I'm showing the manual. You cannot see it?
No, we can see your presentation.
Oh, okay. Zoom is letting me down.
Yeah, I think maybe you can.
Yeah, I need to change.
Share again and then choose that manual.
How about now?
Yes, yeah, now we can see.
Okay, sorry about that.
No worries.
So yeah, this is the manual, which is made in a form that it's easy to print and fold it as a book. So first of all, we see how to install the application, then how the installing process looks like. Of course, we need to know that it's really differ regarding their phone. Some users might have newer phones and some have older phones. But after this, I will show the video so we can see how the new version looks like on the new phone. So Mega partners might remember that this is how the older start screen was looking like. So we had made some major changes. And since the manual is still including old pictures, we are going to update this manual so that nurses have access to newest version of all application manuals and so on. Then how to use the application, what you have to do in order to start the process, how to answer these questions on the application, then exporting the data, how does it look, and in the first versions of the application, while still testing what is the best frame to implement the things, the data was still sent via email. But as you know, nowadays exporting happens within the application and all the data is encrypted, meaning that it's really safe. And even if someone has access to the data, they can't open it without encryption. So no worries, it's extremely safe. And some basic details about the application. So reason why I wanted to show this is that we have done changes what are asked by the partners, and now everything is safe as it should be, following the rules and regulations. And now I will show you a video, which also is available for the partners in the Messi. So you're able to share it with your clinics and universities, and this might be the easier way to understand how to use the application. Excuse me, I'm having a little bit problems with the Zoom. Okay, Annette, can you check? Can you see my video?
Yes, I can see.
Okay, I'm sorry, I'm not a video editor, so it might be a little bit clumsy video, but anyways, you get the idea how to use the Mega application. And it's only a couple of minutes, So when you're training your nurses or when the nurses want to learn by themselves, it doesn't take too long time. Also, the video file is relatively small, so it doesn't take too much of your data. So I want to always highlight that everything what we are doing is funded by the European Union. Yeah, how to use the application. So currently application is available by using the link. We are still discussing with the main partners that should be uploaded on the Google, on the Play Store, because we have to think about sustainability of the project. So either it's going to stay as it is, or we are going to decide to upload the application on the Google Play Store. Of course, this way it would be easier, but we have to also think the safety and lifespan, what happens to the application after the project has ended. So yeah, you download the video, the application. This is how it looks when you do it first time. So the phone is asking you, hey, this is third-party application. Are you sure that you want to install it? Application is totally safe, so you can just press download. Over here it's in Finnish, but it means lataa is a download. Then it's going to start the downloading. Some phones, they show over here like opened application. You can also scroll down where it shows the latest downloads, like over here. Then you just press it. And when you're installing the application first time, you have to enable the phone to install third-party applications. So in my phone, the Samsung is saying like, okay, you have to give me permission to install this application because it's made by third-party person. So then you just press settings. And over here, you just press a button which allows you to install the third-party applications. And then you just press install, which is on the right side over here. The installing takes only a couple of seconds, so it doesn't take too long. It's a relatively small file. Okay, so now installing is ready, and the phone is indicating, hey, the application is on the front screen. So you can either immediately start using the application, or you can just go and do something else and find the application on your desktop. And over here, I'm starting immediately using it. If you're a first-time user for the application, I recommend you to press the About, because it's really explaining detailed what this application about and what it's not. So we have to follow certain laws, and we have to identify what we are doing within this project and for this application. So over here you can see it's not diagnostic tool, and that's what we have to state. And it's basing on DSM-5 and ICD-11. So all the questions are developed by the healthcare specialist. So as a technical partner, we don't have authority to decide what kind of questions we are having in this application. So that's why it's really important that the first-time users are reading all the text what we have put in this section of the application. Then, as you saw in the manual, now the front screen looks a little bit different. It's more clean, and within partners we have developed different solutions. So here you can select different clinics what are part of this project at the moment, then provinces, of course, and username. So in this video, I'm just browsing different options and randomly selecting the different user status for myself, just to demonstrate how to use the application. Then we have several different nurse options. So usually those clinics and universities who are part of this testing file, they are already nominated, okay, Miss Anette is nurse number 1 and so on. So that's why we have so many different options available at the moment. And when you are done with the selecting, you just put the next button. So really simple and user-friendly. In this page, you can start filling in the questionnaire, or you can review the previously filled in questionnaires. So you have several different spots which you have to fill in. So first of all, of course, age of the patient, and then we have this randomly generated user ID. So it's not attached to anywhere. It's just to make the life easier for the nurses if they will need this data for the future. So this is, we don't see this is a private data. It's just randomly generated number, which can be used if needed. And of course, these replies, they have to be based on the discussion with the patient. So this is again demonstration. I will just put some random replies, and they are not based on the real life situation. And when you fill in this section, I recommend press the arrow key. So don't press the enter, just gives more space, but just press the back button so you can back to the questionnaire. Then the reason why the patient is visiting the clinic. So if you don't have any details for this specification, you can always leave them empty, but of course, for the future use, it's useful. So as you can see, there are several sections where you read this to the adolescents. So I recommend to read this, especially when you're using the application first time. Of course, when you use it more often, you'll learn how to use the application. You might learn these questions by heart, so you don't have to spend more time. As you can see, the filling the questionnaire, it's relatively simple, doesn't take too much time. And the main focus why we even developed this application is to save time, because while we were visiting clinics, we noticed how little time the nurses have in the South African Zambian clinics. So the main function is that they save the time. If they have only 5 minutes to see the patient, this is really going to save time, at least according to feedback that we have received from the partners. Then when you have done with your questionnaire, you just press the show the screening results, showing you the algorithm has calculated the results based on this yes, no questions. So for example, if you press yes for some question, it's showing, okay, this patient might have some depression problems and so on. Please make sure the patient will see the proper doctor and discussing about depression and so on. Then you're going to save the folder, the screening, the questionnaire. And because you're using first time, your phone is going to ask you like, hey, can I use your phone storage to save this questionnaire? So of course you have to press yes, which is over here, Sally. Then you can see several different options. So I always recommend you to press the save before exporting. So you're double checking that the data what you were doing is saved. And you can also view this data what is done by pressing the right corner and down, view data. Or you can also start screening new patient if there is no need to export the data or you don't want to see it. And of course, in the middle, you just press the export to export the files. So over here, we are viewing we are using first time, so we can see that we have only one reply, one answer questionnaire over here. Yeah. And then exporting file. Then you just choose the file which you want to export. Usually it's in the front screen when you press the selecting the file, or in some special cases there is specific folder for these kind of files. And all the files are SQL data. So basically this is numbers and small text files. They take minor space, so your phone is really safe for space and future use. Okay, so this is the video for the how to use the application. We will also upload this on the Teams on the YouTube, so you have you can share this with the users. We have also made one extra video, which is including more information about Mega and how to use the application, a similar video. So there are different channels how to use the application. As Annette already mentioned, so currently we are processing the data transfer. So what it means, so at the moment, RTU has almost 1,000 exported files. So really large thank for all the partners who have been using this time to collecting all this data. And we are currently working with TUAS and CSS. Both partners are coming from Finland to make this platform where we can upload all the collected data, and so that partners can also review and do the scientific research based on this data. So so far it's going well. RTU has already exported all the files for Finns, because by the law we are not owners of this data what has been exported for us. So we as middlemen in this process, and partners are going to receive the data for themselves by using this distance learning platform. So CSS is also offering different tools so that partners can implement qualified research. So there are different kind of SQL tools and scientific tools which can be used to process this data. All right, so this is shortly how to use the application, and we are available always. If you have problems with the application, you can send us an email, or you can ask partners to contact us via WhatsApp, and we try to solve these problems as soon as possible. And now we are approaching for the second presentation. Okay. Can you see the Mega seminar recommendation of future plans?
Yes, we can see it.
Wonderful, thank you. Okay, so this is going to be the last presentation before the open discussions and questions. So EU is financing this project, so we have to think what's going to happen afterwards when the project is going to end. Officially, the project should have already ended, but since the COVID, we are going to extend the project lifespan by 1 year. So in June 2021, the project should be ended. So as a technical partner, we have developed, of course, the VP3, which is the Mega application itself, including different technical reports, recommendations, Mega seminars, manuals, and so on. So this seminar is basically the last step of the VP3, and then the VP3 is going to be ended. And as technical partners, we want to find ways to ensure the sustainability of this application, and hoping that maybe after we have done the project, partners are still using the application, or maybe we can develop Mega 2.0. Yeah. So recommendation and visibility, I think they are pretty much the same topic. So we have been using all the channels what are available to promote the Mega application. For example, I personally have been visiting different policymakers, and when we have had meeting, I have always taken this opportunity to promote like, hey, we have this Mega application. It's promoting the mental health, hopefully helping South African and Zambian partners, and they have been always really interested, because the mental health it's a global problem, and it's globally topical thing what each government wants to tackle. So that's why it's really important we have been promoting this project for the policymakers. Especially, I'm proud that TUAS and South African and Zambia partners have been really in close cooperation with the local ministries and policymakers, and been promoting this project. And we have had even possibility to meet with local policymakers, and they have been promoting this Mega application as well. So we are getting the visibility, and hopefully, as an outcome, maybe governments will give more money for the mental health working, or they will develop their own solutions or support Mega 2.0. So that's why while talking about the sustainability and future, visibility is one of the most important things, because without the marketing, nobody knows what we are doing. And I hope that afterwards, when we are done with the MEGA, people are still promoting the application and the project, because we have had some really good outcomes and so good feedback. So we can use this as a case study and maybe even starting point for something even larger development in the South Africa and Zambia. And why not even in Latvia and Finland, because we have seen that the mental health is also a problem over here. We have limited resources and we always need some new solutions over here. So in my first presentation, you saw how the application was looking in the first stage and how it looks now. So the safety has been really improved and it's meeting with the standards. So when the project is going to end, we are going to ensure that safety is still at the level as it should be. So if we see some loopholes or some errors, we are doing our best to fix them. And this is also part of transparency. So we have to keep these results ongoing by at least 3 years, but we hope to keep them up for 5 years. And if there's some technical problems, our team is going to tackle those as soon as possible. So it's more like obvious already at this point that this application, how project is working in the field of healthcare. So we have received feedback which has been really supporting for us, and people have saying that the MEGA application has been really saving their time, and maybe in the future we will hear that, hey, this patient was able to tackle the mental health problems because he or she was able to receive this this help because the MEGA was recognizing like, hey, you need to see this doctor. So we hope that the local clinics could be also using this application after the MEGA application has the project has ended. So we have gathered together a couple recommendations for the people who are working the mental for the healthcare field. So first of all, we hope that as many as nurses could use the application. We completely understand that the resources are limited, time is really limited. Not all nurses have their smartphones, so this might be a little bit unrealistic idea to ask these kind of favors. But if possible, we hope that all the nurses could use the application in the future and test it. We already know that there are people who are using the application. So if possible, if they have time and resources, they could teach their colleagues like, hey, this is the MEGA application. Could you please start using it if possible? And maybe COVID has a little bit messed up all the systems, but if possible, we hope that the nurses could use it on daily basis. So the MEGA application comes as a routine on daily basis when you work with the patients and different clinics. Then even if the MEGA project has ended, we hope that the nurses could keep communicating with us, give the feedback. They are noticing like, hey, this application is not working anymore, or we really love it. Give the feedback what you have, so we can still do the improvements or working with the safety. So if you don't get any feedback, it's really hard to make any improvements. And yeah, that is the most of the points for the healthcare fields. The policymakers. So as mentioned, policymakers have been really helpful for us. They have been listening us, which is amazing, because I have been working with the past 6 years with following similar projects, and policymakers haven't been that forthcoming. They are not interested to help. But since we are working with the mental health, it's really lovely to see how the policymakers have been forthcoming and even listening us. Because sometimes just getting the message out of there, it's something. It's victory for us and the project. So that's why I'm hoping that when there are this kind of projects, not even just mental health, but any kind of healthcare project, that the policymakers could listen us and maybe give some support. If they have resources, they could maybe nominate someone who is like following like, hey, how is your project going? Can we somehow help you? Can we help you to promote the project? And so on. Because we understand that the policymakers, they have many important things to do. But projects like MEGA, they're really able to offer outcomes for the society and for the whole country, which is really cost-effective way to do it. So nominating one person to help the project would be really helpful. Also achieve the goals within the project and within the society. Then we know that societies and the countries, they have the internal funding available. So maybe since they know that, hey, there's this kind of mega project going on, maybe they could cooperate with the universities and approach like, hey, maybe let's write this kind of project. Do you want to join us? And this way ensure the sustainability of the project and development in the countries. So these are the simple ideas for the policymakers. And how the future looks like, it's still a little bit open, to be honest, because the 2021, nobody knows how the year looks like. Hopefully it's going to be a bit better than 2020. But as I mentioned earlier, we are planning that the MEGA application could go online, so to say, and we could upload it on the Google Play Store. But if we are going to make these kind of decisions, it might mean that we will kill some functions, but these are still open questions which we're going to discuss with the management board in early 2021. But we are still keeping the MEGA application online as long as possible, hopefully next 5 years. And we are actively looking for additional funding. So to develop MEGA 2.0, meaning that either we're going to upscale the current MEGA application, or we're going to tackle some similar problem in the South Africa and Zambia. As we know, the EU funding is really slow and it takes time to apply for it, but this is our aim, to develop more advanced applications and solutions for the local field. All right, so that is pretty much all. Seems that we still have 40 minutes for open discussions, and maybe you have some questions or comments so far.
Timo?
Yeah, please.
It's Renelle. I just want to ask you, thank you very much for this information. One of my colleagues, she's also the steering member from our side on the MEGA project. She's a member of the steering committee. She wants to apply for, I think it's CDC funding end of the year. So can I perhaps say that because they are looking for they know about the MEGA app and they are looking for a similar app or even use the MEGA app itself. Is it possible then, if I listen to your presentation, that we can perhaps put your names down and negotiate and talk and see what can be done then, because I'm not sure how much is the funding, but it's really, it seems to me good funding, and they are specifically focusing on a mental health, some type of mental health assessment or something like that.
Definitely, like as the last slide was saying, like we are always looking for different ways to expand this MEGA project. So if you're applying for this thing, we are always up to working with you guys. It's so far it has been really pleasure to work with your university. So definitely.
Okay, so then we will talk a bit later about that. Thank you very much.
Thank you for joining. Maybe any other comments or questions?
I don't see any in the chat, so yeah, and no raised hands either at the moment, at least.
Okay, so I think we can start closing the seminar. I want to take this time to thank you so much. It has been really glad to see that so many of you were able to join this this seminar. So as mentioned, we are going to upload everything what you have seen today on Messi. Afterwards, we're going to also write a report because sometimes might be hard to follow these Zoom meetings, and I'm speaking super fast, so you can always read the report what we have been discussing and see the recording if you want to repeat and show your colleagues. So I want to wish you happy Christmas. Hopefully stay healthy and avoid the COVID, and we are going to see you in the next mega meeting.
Thank you, Timo.
Thank you so much. Have a nice evening.
Thank you. Thank you.
Thank you.